Good day everyone, this is your student nurse Maria Mayuga from BSN 1206, and for today's demonstration, I will show you on how to take a health history interview. First is to introduce yourself to establish rapport or gain the trust of your patient. Second is to explain the purpose of interview and that information is confidential to alleviate fear and anxiety and promote cooperation. Third is to work at the same level as your patient. Pull up a chair and sit next to her or him for about 2 to 4 feet away to provide your patient a comfortable and relaxed atmosphere. Fourth is to begin asking open-ended and close-ended focused questions about patients' health history. It is to gather information for database assessment. Fifth is to make eye contact and listen carefully to the person's responses to questions about health issues. It is to note the person's feelings. Six is to take a good look at your patient's nonverbal behavior if it is consistent with what she is telling you, to observe his or her body language. 7 is to consider your patient's cultural background when obtaining a health history, since cultural attitudes and beliefs about health, illness, and healthcare vary according to person's ethnic and cultural background. 8 is to provide closure by stating almost all information needed has been obtained and the time for the interview is almost over. It allows the client an opportunity to present any other relevant information and avoid surprises when the interview terminates. Lastly is to end with a positive statement, provide reassurance and encouragement. It is to alleviate person's anxiety and fear. So now we will move on to the actual health history interview. Good day, ma'am. I am your student nurse. I am Aliyah. May I know your name, ma'am? Okay, what do you prefer me to call you, ma'am? Okay, ma'am Julian, I'm going to ask you some questions for your health history interview. But first, can you read and sign this consent form? Okay, thank you. So, your full name is Julian Mayuga. How old are you?
41.
41. So, where do you live?
Mabon South San Nicolas.
Okay. Are you single or married?
Married.
Do you have kids?
Yes.
How many?
3.
Okay. Are you working right now?
No.
Okay, so let's go with the interview. Is it okay if we start now? Okay, so what brings you here in the hospital?
Headache.
So how long have you been experiencing this?
3 days.
3 days. Okay. Does it hurt anywhere else? Can you describe what the pain feels like? Do you feel some dizziness?
Dizziness. Sa pag nagsi-cellphone.
Oh, okay. In scale of 1 to 10, how will you rate your pain?
8.
8. So, does this come and go, or is it kind of persistent? So, when does your pain is worse?
No.
Your pain is worse whenever you're like hanging out with your friends or using cell phone or
Using cellphone.
okay. Did you take medications?
No.
Okay, moving on. Can you tell me about your past health history in any previous illnesses, hospitalizations? How about surgeries?
No.
Okay, good. Do you take other vitamins and supplements?
Vitamins.
Okay, how about herbal medicines? Okay, good. So are you still up to date with your vaccines and immunizations?
Vaccine.
What kind of vaccine?
Pfizer.
Okay, any allergies to food or medications? Okay, so next I'm gonna ask you about few questions about your family background. Is it okay with you? Are you comfortable? Okay. So do you have any family member that has any diseases or illnesses? Okay, is there anyone in your family who is diabetic?
Diabetic. My mom.
Oh, okay. Epileptic? How about someone with asthma? Okay. How about cancer? Hypertension?
Hypertension.
Your mom as well? Okay. Any mental disorder?
No.
Okay, that's good. So you're experiencing headache for, do you have any symptoms along with your headache?
No.
Okay, can I ask if you're eating well?
Sometimes.
Okay, that's good, I think. Do you have skin problems?
No.
Okay. How about your eyes? Do you have a clear vision?
No.
Okay. Have you ever checked your eyes before?
Yes.
Okay. Do you wear glasses?
Reading glass.
Okay. Any complaints about runny nose,
No.
bleeding nose? Okay. Have you ever had a hard time sleeping?
Mm.
Okay. Any heart problems?
No.
Chest pain?
No.
Heartburn?
No.
No palpitations?
No.
Okay. Do you feel like vomiting sometimes? Being nauseous?
No.
Okay, very good. So do you have any religious to do or perform while you're admitted in the hospital?
No.
Okay, Ma'am Julianne, according to what you have said to me, you're experiencing headache for 3 days now. The rate of your pain is 8. This occurs when you're using your phone. Is that right? Okay, ma'am. I'm gonna put all the information in our computer. Rest assured that we'll do everything to improve your health condition. So if there's anything you need or anything that's bothering you, please don't hesitate to ask our telephone. Okay, ma'am. Thank you so much for your cooperation. Thank you. That's all.